You know, community health and public health is a large topic of conversation here on the island. And joining me now is Dr. Paul Elam. He is the Chief Strategy Officer with the Michigan Public Health Institute. It's a nonprofit public health institute. So, Paul, go ahead and tell us who you serve and really what the mission is. Explain to all of our viewers.
Absolutely. Welcome. Glad to have me here, Christy. We are MPHI. We are a Michigan-based nonprofit public health institute. We were created by the Michigan legislature over 30 years ago to really provide capacity, innovation, and expertise to our state health and human services and public health infrastructure. So we really do work with local public health, state public health, and national public health to advance well-being for all of our citizens.
And so an organization that has been going for over 30 years and meeting with a pandemic over the last year and a half. Talk to me about some of the things that have changed and how you have maybe mobilized your operations in a different way because of COVID-19.
That's a great question. In our strategic plan, we have a goal to help the state respond to public health threats as they emerge. And so we were tested on that goal this past year in response to the COVID-19 pandemic. I know we helped with two large COVID-19 efforts by distributing federal resources throughout the state. We sort of served as a conduit to do grant making to public health experts, local public health experts, to get really all of those resources out, masks, hand sanitizers. And when you look at the logistics of working that out for the state, I think the state's able to move money, but in terms of moving and executing contracts at a quick pace, that's not something that our bureaucracy does well. And so as a nonprofit partner, we were able to sort of support that and really issue about $40 million in COVID-19 resources throughout the state to support the state's public health mandate.
That's an amazing amount of money and resources. When we look at the pandemic and everything that it's changed for us here in the state of Michigan, it's also exposed disparities in terms of access, education about healthcare, and impacting different communities in different ways. Also, our mental health. Talk to me a little bit about how maybe our resources should change or what we need to start concentrating on when it comes to gathering communities so they are not so impacted by a pandemic.
Yeah, we believe in trying to get upstream and understand where some of the underlying issues are that drive inequities, particularly public health inequities. And so we focus on the social determinants of health, right? Where people live, what policies might be contributing to lack of access to food, insecurities, homelessness, housing issues. And what we found early on in this particular pandemic, when you think about the epicenter of the communities that were impacted most, they were definitely in Southeast Michigan, with the exception of prisons and jails, in a particular zip code area. And so we tried to go in and talk to youth in the Cody Rouge area, for example, to find out what some of the concerns that they have. And while we might be privileged to socially distance in our homes, some communities are not able to do that, right? They live in homes where they don't have separate bedrooms. They're not connected to Wi-Fi. And we've noticed that during the pandemic, violence has gone up, lack of access to education has gone up, social isolation has gone up in some of these communities that we're concerned with. And so I don't think there's a one-size-fits-all experience trying to manage our response to COVID-19. We've also seen mental health concerns, right? We've talked to many youth who are trying to navigate and make sense out of what does it mean to be isolated in a home that doesn't have access to resources. It might be food, it might be just connecting socially, it might be connecting with peers. Many of our kids, for the first time, their escape from living in poverty and situations that were unsafe was going to school or being able to participate in after-school programs.
That was the normal part of life that they were able to escape from or escape to.
Absolutely, absolutely. And so we're beginning to try to learn that and trying to develop strategies to help mitigate and prevent those types of I would say, unintended consequences from happening as we try to manage public health threats that emerge. I can talk a little bit more about some of those strategies later.
Yeah, no, go ahead. Well, why don't you tell me about them now?
So one of the things that we want to do is really work with the federal government, CMS, work with our Medicaid director in the Department of Health and Human Services, and also begin to look at partnerships with local public health to build what we call credible messengers. I think a credible messenger is someone who is trusted by that community, right? And oftentimes the formal institutions that we set up, maybe it's our governor, maybe it's our state medical director, maybe it's the local public health official. They're credible in the eyes of some of our communities.
Yeah, but not everyone.
Absolutely. But not everyone. And so I think we are trying to find out who they can reach and then build another set of stakeholders who can reach other citizens who live in our communities. And so you have social media. Right. You have your peers who oftentimes aren't very informed on the science around public health, but they're credible.
They've passed along 5 other messages they received from someone they maybe totally didn't know. But that's really the source of information for so many during this, and feeling that connection. So do you go, is it churches, is it schools, is it block clubs? How do you go about identifying those good partners and saying, look, we need help in disseminating the information that people feel that they can trust, and that they can feel that they can put their hand on someone and say, I understand, I got you, and I trust what you're trying to tell me.
Absolutely. It's all of those. I was just talking to our CEO, Renee Kennedy, this morning, and she was reflecting on her early days in public health. And it really is a formal approach coupled with an informal approach. Why you go out and you do targeted public education and outreach using nonprofits, faith-based organizations. You can also spend time connecting with folks that you randomly come into contact with in communities, right? And so I think we want to do both, but what we're trying to get laser focused on is who are the credible messengers and provide resources and education to those groups, right? It might be a fraternity, it might be a sorority, it might be a football coach who is credible in the eyes of many of our young people who won't connect with an elected official because that person never shows up in their community.
And you know what, I think that's really interesting, because when you're talking about working with our young people right now, you are forming the way they're going to perceive the world in their adult lives. So what's happened to them now, and living through a pandemic and disseminating what they should be doing, what's right or what's wrong, or how they should proceed and be as safe as possible. You're informing how they will make those decisions when they're 35 years old, when they're a member of the community. And the impact, it can't be overstated, what you're working on right now.
Yeah, I think fundamentally we're working on what we call the 2 R's, relationships and reputation. And I think relationships go a far way. There's a saying that people don't care how much you know until they know how much you care. And when you show up and build authentic, genuine relationships, and I think you become a source of credibility. I think also focusing on our reputation. A lot of the hesitancy that we see in the public health space, which contributes to inequities, really relates to the historical reputation that many of our governmental agencies have been a part of. And so I think people are questioning, is this really someone I can count on based on their historical reputation, right? Whether it be a doctor or a local public health institute or some other medical or healthcare professional.
So just in the minute that we have left, Paul, so what are the important conversations that you plan to have up here to be able to expand that message?
Absolutely. We are trying at MPHI to become a trusted source to discuss issues related to health equity in the state of Michigan. Our mission focuses on promoting the health and well-being for all citizens. When we see inequities, we think it's our responsibility to shine light on it and have a educated conversation about it. And we think it's the responsibility of public health professionals to address that. We're working with the University of Michigan, with our Medicaid department, with CMS at the federal level, to bring resources into our state to gather data and evidence so that we can do public reporting and share it with our entire populace around what's the state of health equity geographically in terms of other social demographics, so that people can ask questions and we can respond as we need to address those inequities.
Well, we look forward to following your work in the months and years to come. Dr. Paul Elam, it's good to see you. Thanks so much for joining me. I appreciate it.
Thank you, Christy.